Maayong adlaw natong tanan. In this video, I'm going to discuss the things that you shouldn't do after an open heart surgery, or what they call coronary artery bypass grafting. Hi, I'm Nathan. I'm your occupational therapist. My goal is to help you be more consistent with your therapy at home. In this video, I'm going to discuss the things that you need to observe after you had your open heart surgery or your coronary artery bypass grafting. So these sternal precautions need to be observed so that you don't re-injure the surgical site. You don't want it to open up again, and you really need to take care of that. So be patient with that surgical site to heal up, okay? So there are sternal precautions that we need to observe, right? Sternal precautions depends on what your surgeon suggests or decides on. But usually they include the following. First, use the pillow they provided after you got discharged from the hospital. Usually they give you a heart-shaped pillow or a teddy bear. But since I don't have one of those, I'm just going to show you how to use the pillow using a throw pillow. So they give you one to equalize the pressure when you are sneezing, coughing, or laughing. Alright, so use that pillow. Even when you are getting up from sitting down, right? Use that pillow so you are not going to open that surgical site. It will equalize the pressure from the inside and the outside. Okay? Number 2, don't reach overhead. Sometimes we need to reach overhead, right? Like when we are putting on a shirt or when we are washing our hair. So putting on a shirt, I'm going to show you how to do that. But first, you need to get your loose-fitting clothes. Use that for now so that it's easier to maneuver, right? So I'll show you how to put on a shirt. All right. So putting on a shirt, what you need to do is to put on one arm first. Again, avoid reaching overhead. So you just go this way. Just be easy. Take care of that surgical site. Next would be the head. Next would be the other arm. Right? And then adjust. Alright, so that's how you put on a shirt. Next, how would you wash your hair? So just bend your neck like that. And then scrub your hair, scrub your scalp like that. Yes, you can take a shower after surgery, but what you want to do is to face away from the shower. So if the shower should be here, you're facing away. So, and let just the water drip, okay? But first, ask your doctor. We should ask the doctor what activities are allowed. Ask if you can take a shower. All right, so again, just bend your neck and gently scrub your hair. Do not go this way, just this way. Okay? Number 3, don't reach your arms all the way to the side. So when you're asking for a hug from your loved ones, don't go this way, just this way. Okay? Number 4, don't lift heavy objects. Don't lift more than 5 to 8 pounds. Again, this depends on what your doctor decides. So, a half gallon of milk is about 4 to 5 pounds. So, that will be your basis on how heavy that you are allowed to lift. Okay? Number 5, don't push. This includes pushing yourself up from sitting down. So when you're normally when you stand up, you're pushing with your arms, right? So since you're not allowed to push, still use the pillow they provided you. All right? So what you want to do is to scoot almost to the edge of the chair. Make sure you don't fall. Bring your feet back slightly behind your knees. Then hug the pillow they provided you. Lean forward and stand up slowly like that. Okay? So, no pushing. Number 6, no pulling. So, this includes pulling a door, a heavy door. So most doctors' offices, the doors are heavy or they are hard to pull. Please ask your companion or wait for them to open the door for you, okay? So again, no pulling. Right, number 7, please don't drive yet. The reason behind is in case there's an accident, there will be a lot of pressure on your surgical site. Plus, you are reaching over your shoulder, right? Sometimes you have to reach over your shoulder, so please don't drive. Ask somebody to drive you, or better yet, just hail you a taxi or an Uber. So, number 7 again, please don't drive yet. And then finally, ask your doctor how much activity is allowed for you. Please be mindful of how you feel. Stop when you are feeling exhausted or short of breath. Yes, you can exercise it. It's still very important to do your exercises, okay? But ask your doctor how much you are allowed or how many minutes you're allowed to exercise before stopping to rest. But usually they'll just tell you, be mindful on how you feel, stop when you are exhausted or short of breath. But you can still exercise. Okay, so that is it, guys. Those are your sternal precautions, or the things that you need to avoid after an open heart surgery or after you had the coronary artery bypass grafting. It is a mouthful. Alright, so if you find this video helpful, please click on that subscribe button and share this video to your loved ones or your friends who had an open heart surgery so that they can take care of that surgical site and they can go back to their normal functioning. Okay? Again, my name is Nathan. Don't forget to exercise our body and our mind so we get stronger together. Paalam!